So, if you or someone you love has just gotten an oral cancer diagnosis, I know that the mountain of medical jargon and all those different treatment paths can feel, well, completely overwhelming. Today, we're jumping right into this explainer to decode the official clinical guidance and map it out so you know exactly what lies ahead. We're going to explore the medical science together and break down the entire journey.
We've got a really clear roadmap for today. We'll be mapping out the treatments, looking at the three main surgical options, diving into radiation and chemotherapy, navigating the surgical and radiation side effects, and finally, figuring out how to move forward after treatment. We have a wealth of vital information to cover, so let's get right into it.
Section 1, Mapping Oral Cancer Treatments, Finding the Right Path.
You know, one thing becomes obvious right away. Treatment is definitely not one size fits all. Your medical team looks at three big variables: exactly where the cancer is located, the specific type of cells involved, and how far it's progressed. It's like a giant puzzle. Based on those pieces, they map out a highly tailored strategy for you. So while surgery is the standard baseline, your plan might also bring in radiation, chemotherapy, or if the main goal is just to keep you comfortable and manage pain, palliative care. It's an incredibly targeted approach.
Moving on to Section 2, three main surgical options. The standard treatments.
Doctors generally rely on three main pillars of surgery here. You've got primary tumor resection, neck dissection, and reconstructive surgery. Let's actually break down what happens in each of these steps because the precision involved is honestly kind of mind-blowing.
First step, the primary resection. This is fascinating. The surgeon doesn't just snip out the visible tumor. Nope. To be absolutely sure, they actually take out a margin of completely healthy, normal tissue right around it. It's basically a safety buffer to make sure the cancer can't just immediately take root again in that exact same spot. It's a crucial, standard step to just entirely eradicate the threat.
Now, if there's a risk of the cancer spreading, what doctors call metastasis, they're going to perform a neck dissection. This is where they remove the lymph nodes, effectively cutting off the cancer's escape routes. If the risk of spread is high, or if it's already actively happening, taking out those lymph nodes and the surrounding tissue in the neck is absolutely vital to stop the disease right in its tracks.
And that leads us to reconstructive surgery, which I gotta say is just a remarkable medical feat. To fix any missing areas, doctors can actually transplant tissue from another part of your own body, or they might even use artificial materials, like titanium, to completely rebuild the jaw. It really is a testament to how far these procedures have come, stepping in to restore your facial anatomy and get things back to normal after the cancer is gone. Okay, Section 3, Radiation and Chemotherapy Roles. Beyond surgery. What's really fascinating here is a highly specialized internal treatment known as brachytherapy. So, instead of using some massive machine beaming radiation from the outside in, doctors actually insert tiny tubes or needles directly into the tumor itself, or right next to it. This delivers a super concentrated dose of radiation exactly where the cancer lives, while beautifully sparing the healthy tissue around it. Pretty amazing, right? Now, while standard radiation is super common, for more advanced cases, doctors will combine it with chemotherapy. We call this chemoradiotherapy. Hitting the cancer with this powerful combo after surgery significantly lowers the chance of it ever coming back. Plus, if a tumor just can't be operated on, maybe because of where it is or how much it's spread, this chemoradiotherapy combo immediately becomes your primary line of defense.
Which brings us to Section 4, Navigating Surgical Side Effects. Post-surgery recovery.
Look, because surgery physically alters your mouth, those basic things we all take for granted, chewing an apple, swallowing smoothly, or just chatting with a friend, they can be severely impacted. And this isn't just a matter of waiting for a cut to heal. It means specialized physical and functional rehab is an absolute must. You have to actively work with specialists to get those essential daily functions back. Sometimes it's literally relearning how to eat and speak.
Let's shift gears to Section 5, Managing Radiation Side Effects. Short and long-term risks.
The timeline of these side effects is so crucial to understand. During treatment, high doses of radiation can cause immediate, severe pain in the mouth. That's called oral mucositis, along with a cough and hoarseness. Then, within just a few months, early onset swallowing issues or dysphagia can pop up. But listen, we have to be exceptionally vigilant about the late-stage stuff. Months or even years after treatment ends, patients can develop lockjaw, see a massive spike in cavities, lose teeth, or even face jawbone necrosis, which is the actual death of bone tissue in the jaw. Knowing this timeline, that empowers you to report any of these symptoms the second they happen. Finally, Section 6, moving forward after treatment. Life after treatment.
So, once the clinical treatments are officially in the rearview mirror, your daily first line of defense is keeping up with meticulous, constant oral hygiene. The mouth stays incredibly vulnerable for a long time, so keeping it impeccably clean is vital. And honestly, this next part is a game changer. Always, always tell any future dentist about your exact radiation history before they do any work. Because of those serious long-term risks we just talked about, like jawbone necrosis, your dentist absolutely must know your past treatments to keep you safe going forward.
Surviving the treatment roadmap is obviously a massive milestone, but it's really just the first phase. The big question we're left with is this. Treatment is complete, but how can we prevent oral cancer from returning? Well, we're going to unpack the essential lifestyle choices, the preventative measures, and the recurrence protocols in our next explainer. Until then, remember that knowledge is your absolute best tool. Keep asking those questions, keep talking to your medical team, and keep learning.